once notified of the impacts that were occurring with the supplier, and knowing that there was a 60% reduction of IV and sterile fluids really across the country, we stood up our system incident command within 24 hours of that notification. And then there were a number of processes that really were initiated based on not only assessing where we were with respect to our IV and sterile fluids, but then the convening, and I think this was our biggest takeaway, was the convening of really a clinical advisory group that consisted of over 60 physicians, advanced practitioners, nurses, and other clinical team members, as well as the leadership of myself and our chief nursing officer. And once we were able to articulate the concerns that we had about conserving fluid, then each group really went back and did their homework and returned to us, and I say us, the collective, in terms of identifying where we can conserve fluids, what the process was in terms of notifying bedside team members of what was going on. Ultimately, that led to a little over 140 clinical interventions that were applied. And now, in our recovery phase, almost 70% of those have been accepted as the new standard that we have within UnityPoint. As importantly, and by far the most important for us, is we never turned a single patient away in terms of procedures, including surgeries that needed to be performed during the peak of that national emergency. So we're incredibly proud of what our efforts were there.